Scorecard. So let me just also give you a quick overview of what Lessons is. So Lessons is a component of the Communities in Pandemic Preparedness and Response, or COPPER. So it has a knowledge hub under the COPPER project, and it's implemented by the Activists Coalition on TB Asia Pacific, or ACT-AP, hosted by APCASO, and the Africa Coalition on Tuberculosis, or ACT Africa. And of course, this event will not be possible without the support of the Global Fund. So this Lessons 11 is also co-sponsored by the Regional Learning Hub of Anglophone Africa and the Regional Learning Hub of Asia Pacific. So both of them are also supported by the Global Fund. So we have a very full schedule for today, but let me just also walk you through the guidelines before we formally start. So as you can see right now, the session is being recorded. And I would also like to invite our participants in the Zoom to change their names to this format. So you can put your name. If you're comfortable, you can add your pronouns and also the organization that you're affiliated with. So again, if you're comfortable, kindly change your name so that we can easily identify what organization you're coming from. And in order for us to have a good conversation in this session, we'd like to invite everyone to mute their microphones when not speaking and also turn on your camera so that we can have a more interactive sessions. And at the bottom part of your screen in your Zoom, you can also see the emojis and the raise hands function. So kindly utilize those so that you can also provide some feedback to our participants. You can also utilize the chat function. So you can type your comments or if you're experiencing any technical difficulties, or if you want to introduce yourself, no? So you can also do that in the chat that we have right now. And the session is also conducted in various languages. So right now we have English, French, and I'm not sure if we have Khmer and Bahasa today, but I'm sure we have English and French for today's session. And let's all contribute to making this a safer space. So please feel free to share your opinions, listen to others, and also learn from each other. Okay, so since we have a French translation for today's session, I'd like to invite you to if you want to go to the French channel, you can click on the globe icon at the bottom part of your screen. So you can click the interpretation, and it should show you the different languages that's available. So you can toggle from English to French depending on what language you're most comfortable in. Right. So I see some of you are already introducing yourselves in the chat. So please feel free to share your the organization and the countries that you're from. Okay, so now I'd like to invite everyone before we officially start our session for this session. I'd like to invite everyone to our icebreaker. So as usual, we usually have our Kahoot sessions. So you can scan this QR code. You just need to go to kahoot.it and then you enter this PIN. So 8622312. All right, so let me just toggle to the Kahoot website. All right, so I see people coming in already. So let me know if you're having challenges with the Kahoot. Okay, so I see Jeff already adding the link to the Kahoot website. So it should show you this interface. All right, so Gemma is already there. PJ is already in. So again, the game pin is 8622312. And since we're discussing about PPR for today and how do we actually score it, our session for today will be a general overview of what pandemic preparedness and response is, especially the different values or principles that we apply in PPR. Okay, so we have 30 in the room now, around 32. So ideally we should have at least around 50%, around 15 people coming in the Zoom link, in the Kahoot link. All right, so Jeff also added here the PIN. So it's 8622312. Okay, so we have Taylor Swift in the house for today's Kahoot session. Okay, I'll wait a few more seconds for the people who just joined in so that they can enter. So again, please enter the kahoot.it website and then type this game pin. You can also scan this QR code if that's easier for you. Okay. Can you see the screen now, Jeff? No? Yeah, okay. Just making sure. Okay, so I think we can start already. Okay. All right, so let's start. So again, the mechanics here is that you just need to select the correct answer. One moment. You just need to select the correct answer. And of course, the earlier that you select the correct answer, the higher the points that you will get. So it's not just getting the correct answer right, but also entering those answers as early as possible. Okay, let me start the game now. Okay, so for the first question, which best reflects the overarching principle of pandemic preparedness? So is it red, focus only on emergency response after outbreaks occur? Blue, build proactive systems that anticipate, prevent, and respond to threats? Green, prioritize border closures over health system strengthening? Or yellow, depend solely on international aid during crises? So this should be an easy one for most of us. Okay. So most of us got it right. So it's, again, building proactive systems that anticipate, prevent, and respond to threats. Okay, so we're not just being reactive here because red is quite reactive. So after an outbreak occur, that's the only time that you do the emergency response. We also want a mix of domestic and international funding during crises. And of course, we have to also look at we have to prioritize health system strengthening, and border closures is just one of the many tools, no, that we can use for pandemic preparedness. Okay, so three of us got it correctly. Okay, so Gemma is number one as of now, followed by Taylor Swift, and then Arale or Ariel, and then Leslie, and then Hamidou. Okay, next question. Equity in pandemic preparedness emphasizes red, equal funding for all sectors, blue, equal representation of all stakeholders, yellow, addressing the disproportionate impact on vulnerable populations, and green, centralizing resources in urban hospitals. So which of these is equity? Okay, so four of us got it correctly, addressing the disproportionate impact on vulnerable populations, because we recognize that in a community, not everyone would have the same level of vulnerabilities because of the different identities that we have. And definitely when we talk about equity, it's about providing a support to those who actually need it more. Okay, next question. Okay, Gemma is still on top, followed by Taylor Swift. Next question. A rights-based approach to pandemic response ensures red, restriction of individual liberties during all emergencies. Blue, public health measures uphold human rights, dignity, and non-discrimination. Green, focus on rapid response without consultation. Or yellow, policies are driven by security and enforcement. All right, so I think that's easy. All right, so it's a rights-based approach emphasizes dignity, non-discrimination, and upholding of human rights. Okay, I think that's a bonus round for everyone. Okay, the next question. The principle of transparency in PPR refers to protecting sensitive information from the public, yellow, delaying announcements to avoid panic, blue, sharing timely and accurate information to guide behavior, and then green, limiting communication to health professionals only. All right, so 7 got it correctly. I think a lot more people are joining in the Kahoot link now. Okay, I think that's quite clear. Okay, next. Lessons from COVID-19 highlight that red, border control is the most effective intervention. Yellow, social determinants, governance, and trust are as vital as medical tools. Blue, centralized command ensures success. Or green, technology alone can solve health crises. Okay, so the correct answer is social determinants, meaning the different factors that can influence the health outcomes of people, governance, and trust are as vital as medical tools. Of course, we have treatments, medications, and even vaccines. But of course, all of those will not be effective if we don't have strong governance and we don't establish trust in our communities. Okay, next question. Oh, it's moving. Okay, so let's already number 2, followed by Taylor Swift. Okay. Sixth question. Risk communication is effective when red uses fear to enforce compliance, yellow focuses only on expert audiences, blue provides clear and evidence-based information and empowers action, or green avoids uncertainty by withholding evolving information. So risk communication is effective when it provides clear and evidence-based information, and it also enables action. Okay, so we don't, well, we have to also be transparent in terms of our communication. So we don't, uh, we have to really calculate, especially when we're actually communicating information. And sometimes we also need to communicate uncertainty also during pandemics. I think that's one of the key things that we've learned in the past. Okay, some movement in the scoreboard, especially in number 4, number 5 slot. Okay, second to the last question. The principle of continuous learning in PPR refers to red, using after-action reviews and evaluations to improve future preparedness, blue, assigning individual blame for errors, green, waiting for global reports before adapting strategies, or yellow, completing one-time evaluations after pandemics. When we talk about continuous learning, it's utilizing after-action reviews and evaluation so that we can implement better the next time. Right, so I think everyone got it correctly. Right, so congratulations. Last question. Okay, last question. Under IHR, which of the following best demonstrates core capacity, compliance with core capacities? Red, publishing pandemic data only after donor approval. Blue, delegating all surveillance to WHO. Green, limiting engagement to tertiary hospitals. Or yellow, establishing national systems for detection, reporting, and rapid response. Okay, so all of us, almost all of us got it correctly. So it's establishing national systems for detection, reporting, and rapid response. So ideally, we also should be sharing pandemic data so that it can also guide action. So it shouldn't be limited based on the donor's approval. Okay, so I think that's the last question for this Kahoot. So we have on third place, Taylor Swift. So who's Taylor Swift? Is it Jeff? And that's followed by Leslie at number 2. And then Gemma is first with 6,000 points. And rightly so, because Gemma will be sharing with us later during her keynote message. All right, so congratulations to everyone. And hopefully that served as a good warm up for our session for today, which will focus on um, the introduction to the community PPR scorecard. Okay, let me just go back to our main screen. I'd also like to confirm if Dr. Emil Lomo is already with us in our call.
IJ, not yet. So we could proceed whenever she comes in, then she can give the remarks at that time. But I think let's proceed.
All right, no worries. So let's proceed to our first session for this lessons webinar. So our keynote presentation will be delivered by Gemma Oberth. So Gemma Oberth is a consultant based in Cape Town, South Africa. She has worked with the Global Fund since 2017, supporting community engagement and broader community system strengthening initiatives. She is trained as a political scientist and has keen interest in inclusive and transparent health decision making. So without further ado, I'd like to introduce Gemma Oberth, the consultant for the for the community PPR scorecard. So take it away, Gemma.
Thanks, RJ, and I'll try to be as quick as I can so we make up time. Can you see my screen?
Yes, we can see it.
Great. So what I'm going to do very quickly is take you through the two new tools that have been launched today. It's one tool, but there are two parts to it. So I'm just going to show you how they look, show you the different sections, and then do a bit of a live demonstration on the scorecard itself so that when you go to use these, it's not your first time and you know what to do and where to go. So today we are launching the new Community Pandemic Preparedness and Response Scorecard. The purpose of this is as a self-assessment to really determine the level of engagement, community engagement, equality. This is focusing on issues of gender and equity and vulnerable populations, and human rights in global health security processes. I think it's key to mention this was a very collaborative process to develop this scorecard. I'm sorry that the writing is small, but you can see many organizations, community-led organizations from all over the world have contributed to this scorecard. So quite a collaborative global effort from affected communities around the world. It gives you a bit of a background to start off with about why community leadership and engagement is so important in PPR processes, what we've learned from COVID-19 and other pandemics, and why this is really needed to make our responses stronger. It gives you a bit of background on the Copper Initiative. If you've been tuning into these lessons, we're at number 11 now, right? So you should know what Copper is and what it's doing, but in case you need to brief your colleagues, there's a bit of background here. And why do we need to have a scorecard like this? Why do we need to have communities engage in this kind of shadow assessment, self-assessment process? That's also contained here. It gives you the scorecard objectives to primarily assess the level of engagement in national PPR processes, and there are some subsections there, and also to try to improve from there. So based on your assessment, what next? And you'll see from the tool that it provides you with an action planning template. So that gives you the next steps after you do the assessment. The guidance also goes through the uses of the scorecard, has a very important section on definitions of communities. This is always a tricky one, whether we're talking about HIV or TB or pandemic preparedness, it's always a question that comes up. So this does give you a bit of a suggestion of how you can consider affected communities in the context of PPR. Of course, it will be different depending on the country, depending on the health emergency that you may be examining. So with that caveat. All right, then the guidance takes you step by step through these 5 steps in the scorecard process. I won't go through each one, but it's color-coded, so you can follow the wheel and follow the colors, and it should give you a very simple approach to completing the tool. It tells you how the scoring is done. I'll show you this in the tool itself. It's a 3-point scale, very easy. So the red would be the lowest score. The light green is somewhere in the middle, and then the dark green, 3 points, is the best possible score. And the guide gives you a bit of an overview about the 3 sections of the tool, which on the cover page, as I said, includes engagement, equality, and rights. So what do those 3 dimensions include? What does it mean? And then when you're finished, how do you act on the scorecard findings? What do you do with this information? Where do you go from there? How do you take action? How do you develop the action plan and go forward? And finally, the guidance gives you some additional resources. So these are hyperlinks here across the 3 dimensions: engagement, equality, and rights, if you want more information or if you need a bit more guidance as you complete the tool. So that's the narrative guide. Now I'm going to show you the tool itself, which is an Excel-based tool. So you'll recognize these parts. It's just showing you the process again, and the scoring and the steps. And the tool has an automated dashboard, which is blank now because we have not completed it, but once I go through and select options, you'll see this come to life. So let's come back to the dashboard after we've gone through the tool. All right, so along the bottom, you can see there are 3 tabs that say engagement, equality, and rights. So these are the 3 dimensions again. Then for each one, there are several sub-dimensions. There's a definition of what is being asked here. But all you have to do as the one completing the tool is to go to column E and pick and do your self-assessment. So for each one, there will be a drop-down menu, and there will be 3 scenarios described. And you need to choose which one most closely reflects your reality. Now, you may say, oh, I'm not quite in the middle, I'm not quite here. It's not perfect. There's only a 3-point scale. Choose the one that is closest to your situation. So you see, if I pick the lowest one, I get a red, a level 1. If I pick the middle one, I will get the light green, and so forth, okay? So you go through as a group, you consider which of these 3 most fits your context, and you fill it in. So I'm just going to fill it in randomly just so we can see what it will look like at the end. All right, so you can go one by one if that's the way you decide to do it. You can also choose to sit in groups depending on how you apply this tool. Maybe you want to have one group working on engagement, one group working on equality. It will depend on the country. All right, you'll also notice there's a column on the right that says notes or comments. So please feel free in here to explain your decision. Why did you choose 3? Why did you choose 2? Why did you choose 1? Or if you feel there's, maybe you feel you're a 2.5, but you want to just explain that, you have that option in the comments. So the comments you can free write. You can write anything here that you like. Okay, so it's really, I think, quite straightforward and simple. I've now completed everything. So if I go back to my dashboard, now it comes to life. So now you can see, based on what I've chosen, how am I performing? Okay, so I got a 68% overall. That's my overall score. My overall community pandemic preparedness threshold is at a moderate level. I must have picked quite a balanced set of random answers. But you can see, okay, based on my random selection, equality, I'm doing much better than the other 2 dimensions. At the bottom there, you can see that got a score of 73. So this gives you different ways of looking at community engagement in PPR. This is quite handy as well if you want to take a screenshot of your dashboard, put it on a slide, makes it easy for you to communicate the results to others. Okay, then lastly, we have an action plan tab. Let me make this a bit bigger. This one, you can pick your dimension, pick your subdimension, and then the rest you can free write. What next? What are we going to do about this? Who are we going to engage? What kind of support is needed? So this is a more open part of the tool where you can develop your action plan. There's also some resources embedded in the tool as well. And finally, if it's helpful for you to see, here's the whole framework. If you want to look at it all together, here are the different categories, thresholds for each one. So this is, like, again, just for reference at the end here. So I think with that, I will close and we'll turn over to hear from some of the countries how the piloting has gone, I believe. But I hope you find this tool to be useful, user-friendly, and we'd love to hear from you about how it goes. Thank you.
All right. Thank you, Gemma, for walking us through the tool itself, as well as the different well, Excel file, the dashboards, and also the link, how it links to the actual plan. And based on the comments right now in the chat, a lot of them are actually asking where to download it, and also how to actually also access the different tools that you shared earlier. So for those who are interested, so I'd like to share this link so it can already be downloaded. So you have the Community Pandemic Preparedness Scorecard in this link. So you just need to go to this link. We can also share this to you later, but it's bit.ly 485WTKH. Right. And then later, I think we'll also have time to ask Gemma some questions regarding the tool. But for now, I'd like to also invite the different countries who have piloted the implementation of the scorecard. So we have two, one from Cameroon and one from Nigeria. So uh, for Nigeria, so we have Paul Balogun. So he is a community engagement specialist and a social policy advocate from Nigeria with extensive experience in health system strengthening, climate health resilience, and advocating for vulnerable communities. He is a team member at Jana Health Foundation, where he leads projects on pandemic preparedness, TB HIV response, and climate health equity. For Cameroon, we also have Bernadette Ngob Bikotok, who is a public health professional with a strong academic background, including a master's degree in project analysis and sustainable development from the University of Rennes in France, and a master's degree in epidemiology and public health. So with over 4 years of experience, she has refined her expertise in different fields, particularly in epidemic and pandemic preparedness and response. She has also demonstrated proven ability to lead and evaluate field epidemiology activities, mass campaigns, and targeted interventions for high-risk diseases such as cholera, yellow fever, measles, COVID-19, tuberculosis, and other respiratory illnesses. So I'd like to invite Paul first to share their experience in Nigeria, and then this will be followed by the experience of Cameroon through Bernadette. Over to you, Paul. Let me just also load Paul's slides up.
Yeah. Thank you so much, RJ. And hi, everyone. Good to have you on this call. First of all, thank you for the presentation on the scorecard, which is very clear to all of us as well. We were able to carry out this piloting study. RJ, if you can put on my slides, I think it would be better. Thank you. Thank you. RJ is coming up.
Can you see it now?
Yes, I can see it. Thank you very much. So Thank you. I think I will not waste much time in the introduction. If you can go to the next slide, you can see from the Nigerian aspect why this scorecard is very important to us. Now, previously during the COVID-19, it has actually exposed the gaps in terms of understanding community and building trust with community. Community first when it comes to dictations, when it comes to response as well. But however, community, there is a gap during the past pandemic like COVID-19, which exposed community trust as well as engagement. So this tool is key in terms of understanding as well as inclusion of community voices. So if you can see, previously, as well as what is going on, is kind of a top-down bottle communication where people from the hospital bring out informations, people from the health sectors communicate to people on what they should do, but they do not actually hear from the community what is expected or what is it that we want to, what is it that the community wants. It is, for example, that when a person go to a hospital, a technicians or rather a clinicians will actually prescribe a drug for him without understanding or hearing for him, which is very unfortunate. That was what we noticed during the COVID-19, and this scorecard was very essential in terms of bringing collaborations as well as understanding the need of the voice of the community into the health policies, as well as tracking equity in terms of doing our activities, both in terms of gender and rights of all communities as well. This will actually create more what we call the resilience aspect and accountable, not only for the health sectors, but as well for the community. And in the next slide, you can also see that in Nigeria, while we pilot this study, we use a different methodology which we call a multiple level approach in order to test run this tool in Nigeria. Through the Copper CE, what we try to do is that we engage the community-based organizations as well as networks within the community that we are working with them. So we sit together to come up as well as do this assessment together with them. So this is one-on-one. And again, we actually share this through to the CSOs as well as coalition members who are within our actually working scope. So the scope in Nigeria, already you can see Nigeria is a wider country. So we are able to distribute this through the Northeast coalitions platforms that we work together with them. And again, when it comes to the health structures as well as accountable and ownership, so we were able to go to the community again to select some key community leaders within the communities and key actors, and also deliver this tool together with them. And again, at the national level, we also selected some key participants, not only the partners, also the stakeholders as well, to hear from them. So we also do this so that we can have a robust idea behind everything. So you can see the steps that we get into this. One is to define the scope. Who are we going to contact? And what are we expected to communicate to them? So for example, in a particular setting, we may be able to contact a woman group, or rather through the Women Affairs, to see what were their response regarding gender issues. And again, in terms of coalition information, what we did, despite the fact we're able to distribute these informations across all, so the next thing we did now was to bring these informations all together in a one summary document, which was a multi-task to us at first instance. So in terms of bringing them all from the community information that we gather, and then also CSO's national platforms, as well as community health workers and well leaders. So collating this into the scoring was actually what we did again. And then after collecting it, we also do a validation to make sure that everything actually works well. So this validation brings about different actors from different communities from each of these segments that I mentioned in order to validate this, which was done online. So from there, we were able to come up with informations and actions plans, of which some of the recommendations that we had were added up into our advocacy's agenda as well. So in the next slide, you can see um, some of the lessons we learned is that before now, there were no engagements that was very clear at the settings where we work, where brings community together in terms of understanding, and community knows that this is what it belongs to them and this is what they should actually fight for. So that has actually become a challenge, and one of the lessons we learned that community engagement is highly a gap in Nigeria, as well, especially in places where we work. And during this activity, it created a kind of a collaboration between the government and then the community as well as CSOs to come together to understand uh, these key uh, gaps that we have identified, which give us a step ahead in terms of our advocacy. And it actually opens a gap in terms of gender as well as human rights, where different communities were not included. Although this assessment needs to go far, but due to the time frame as well as funding gap, we're able to do it online as well as not covering all aspects. So the document before now, I think before sharing the dashboard now, there were some technical gaps for people to understand what it is that is required from them and how they will be able to respond in filling it. Before having the dashboard, that was what we tested. And several CSOs, while we contact them, their input were partially due to busy schedules of activities. So organizing that was actually a challenge to us, but we are able to get response from others. So, and also, like we mentioned, integrating this into a one useful dashboard, or rather one useful document, was a challenge in terms of avoiding barriers, as well as understanding what are the key things that are required to be inputted based on these three scoring that we already have. Accountability framework is one of the key things. For community to also understand what they are accountable for, and to also define the line of responsiveness between the community as well as the stakeholders, was also a gap during the assessment as well. So in the next slide, you can see Ajay, if you can make to the next slide, some of what we did now is that we were able to see some of those findings, and in these findings, we were able to come up with an advocacy agenda, which will be able to integrate with some of those assessment we did to the past, advocating for the voices of the community, advocating for more funding when it comes to gender and human rights issues into the national plans like the National Action Plan on Health Security. And also, this actually pave a way and give us a backbone on coming up with our advocacy briefing in terms of inclusion of voices into the pandemic platforms. And this is very key to us in terms of doing activities. That is where we understand that different communities as well as different networks have a knowledge gap on what pandemic fund is, what JEE is, what SPA is, what National Action Plan they are. So we were able to link much CSOs as well as community to the global learning platform where knowledge is being shared as well. And this is the platform where we are actually having the meeting today. So again, if you can see here through the pictures, this is where we come in different sections through the community as well as through coming together in meetings to discuss and then share information about the scorecard, as well as meeting to collect the scorecard all together. The center of everything is to make a pandemic preparedness and response people-centered and accountable, so that each sections will become accountable to what they are required and what are the key responsible for each person. Thank you so much, and that is over for me. Let me just wait by and attain more clarification. Thank you so much.
Thank you, Paul, for that very short but very insightful presentation. I think one of the things that you mentioned from your talk is really how we use the tool to actually strengthen the collaboration with government. And it's also a tool that was used to deepen the appreciation of the context that you're in Nigeria, allowing you to articulate better what are the gaps in terms of civil society participation, and then using the findings to actually influence how you work with government through the different plans and policies that are in place. So really inspiring work, Paul, and Team Nigeria for that. So now I'd
Thank
like to thanks, Paul. I'd like to call on Bernadette for her presentation for Cameroon. So
Hello
let me
everyone,
just
thank you,
also
Jay.
load the slides for Cameroon.
I have an issue with my camera. Bonjour, bonjour tout le monde. Ok, RG, c'est bon. Bonjour tout le monde. J'ai pas besoin de me présenter. RG l'a magnifiquement fait tout à l'heure. Alors, je vais vous présenter l'expérience du Cameroun en ce qui concerne notre utilisation de la Community Scorecard et les différents résultats que nous avons eus durant sa mise en œuvre. Slide. Alors, vous le savez bien, la pandémie à COVID-19 a agi comme un véritable révélateur dans notre système de santé. Donc, la pandémie a mis en lumière les lacunes critiques de notre système de santé. AJ.
Okay, sorry. Can you see the
Bon,
screen now?
not yet.
Okay, let me just try.
OK, le temps que tu positionnes, je vais continuer. Comme je disais tantôt, la pandémie à COVID-19 a mis ici en lumière les lacunes critiques de notre système de santé, notamment en ce qui concerne la protection des communautés. Donc, il était ici question vraiment de revoir nos standards et nos pratiques en matière d'équité des genres, de droits humains et surtout d'engagement communautaire. Donc, c'est ici que se positionne le projet Cooper CE qui a vraiment ici pour but d'assurer que les communautés et la société civile participent de manière efficace à tous ces processus nationaux là, de préparation et de réponse aux pandémies, ce qui est également une priorité au niveau mondial, parce que l'OMS également a inclus dans la 3e édition le manuel de l'évaluation externe conjointe les indicateurs en matière d'équité de santé, d'égalité des genres et de droits humains. Donc, ça s'aligne vraiment parfaitement avec ce scorecard qui a été élaboré dans le cadre de ce projet Slide. Alors, notre objectif ici était vraiment de recueillir les données pour évaluer le niveau de mise en œuvre des activités liées au genre, aux droits humains et à l'engagement communautaire au niveau national. De manière beaucoup plus spécifique, il était d'abord ici question de sensibiliser les participants sur tous les domaines clés de la préparation et de la réponse aux pandémies contenus dans le manuel d'évaluation externe conjointe, de collecter les données sur la mise en œuvre de ces domaines clés-là, d'identifier les différents défis rencontrés euh, au cours de l'utilisation de la scorecard qui était en sa phase vraiment d'élaboration préliminaire à cette période-là et de proposer des recommandations pour améliorer l'outil et surtout en ce qui concerne l'amélioration de notre agenda de plaidoyer. Slide. Donc, la méthodologie que nous avons utilisée ici était, si je peux dire, une méthodologie en 2 étapes. Donc, l'outil, à cette époque-là, avait été développé en anglais. Donc, étant dans un écosystème qui s'exprime majoritairement en français, on l'a traduit de manière assez fidèle et ensuite on a procédé à un pré-test dans l'une des régions du pays, la région du Sud. Et en deuxième étape, on a procédé également au pilotage de l'outil en lui-même, comme on va le voir dans les slides suivantes. On a également essayé de vraiment collecter tous les documents qui pouvaient supporter le choix de nos indicateurs. Comme l'a si bien démontré Jima tout à l'heure, les indicateurs vont de 1 à 3. Donc, à chaque fois qu'un score était choisi ici, il fallait justifier pourquoi est-ce qu'on a mis 1 sur cet élément, pourquoi est-ce qu'on a mis 2, pourquoi est-ce qu'on a mis 3. Donc, slide. Donc là, vous avez les images du pré-test qu'on a eu à mettre en œuvre le 13 février avec les membres d'une coalition nationale qui est le réseau national des organisations One Health. Donc, durant leur réunion de coordination, nous avons été conviés. Nous avons piloté l'outil de manière vraiment préliminaire ici et nous avons recueilli un certain nombre de retours qui ont été confirmés, qui a été confirmé durant la phase de pilotage proprement dite le 3 avril, donc dans une autre région du pays avec beaucoup plus d'acteurs, mais cette fois beaucoup plus d'acteurs diversifiés. Là, nous n'avons pas juste travaillé avec les organisations de la société civile, HIV, TB Malaria ou alors des personnes vivant avec des handicaps et d'autres groupes vulnérables, mais ici, nous avons vraiment inclus pour authentifier les résultats que nous aurons et toujours mener un plaidoyer assez robuste, les membres du gouvernement. Vous allez voir là le MOH qui est le ministère de la Santé qui est là et des départements sectoriels. Nous avons également invité le ministère des Affaires sociales, le ministère de la Communication et le ministère de l'Administration territoriale qui étaient vraiment ici l'objet vraiment de leur insertion ici était non seulement d'authentifier les résultats de cette carte score qui avait été préalablement pilotée par les communautés, mais de vraiment pousser ici vers un plaidoyer assez fort par rapport aux résultats qu'on a eu durant le pilotage de cet outil-là. Slide. Vous allez le voir là, vous avez Tibet People Cameroun, vous avez le Conseil des imams et des dignitaires musulmans, qui est une coalition forte au niveau du pays. Vous avez le FEO qui était également là et la plateforme CS Formé, en plus de plusieurs autres partenaires qui étaient également présents pour le pilotage proprement dit de cet outil. Slide. Alors, parlant des résultats, là, comme Dima l'a très bien montré tout à l'heure, je reviens juste vraiment de manière synthétique ici. Vous allez voir les indicateurs contenus dans la matrice sont répartis sur 3 scores. Vous avez un premier score qui est le score faible. Vous avez un score intermédiaire ici, représenté par la couleur jaune qui est un score modéré, et le score croix qui était vraiment le score le plus élevé. Donc, comme Jim l'a si bien montré tout à l'heure, vous allez voir qu'en fin de tableau, vous aurez les notes, c'est-à-dire ici les éléments pour pouvoir justifier le choix du score qui a été fait. Nous, au niveau du Cameroun, à cette section-là, nous avons inséré tous les documents qui soulignent, qui justifient le choix du score qui avait été fait. Donc, si on avait un score de 2, là, on insérait le nom du document ou alors le lien hypertexte du document qui justifiait effectivement le choix de ce score-là. Slide. Parlons des résultats de manière générale, avec le cumul des 3 piliers, des points des 3 piliers qui étaient au nombre de 63. Nous, au niveau du Cameroun, nous avons eu un score de 33 points, soit 52,2%. De manière générale, c'est le score que nous avons eu au niveau du Cameroun. Slide. De manière beaucoup plus spécifique, si on regarde des différents piliers de l'outil ici, le pilier qui a obtenu le plus de points était le pilier de l'engagement qui avait un score de 82%, qui était suivi par le pilier sur le genre qui avait très peu de points, soit 18% et ainsi de suite. Alors, la principale recommandation qu'on devrait faire au préalable avant le pilotage de cet outil est de vraiment organiser des sessions de briefing des communautés et de la société civile, ainsi que tous les autres partenaires que vous voudrez inclure dans le pilotage de cet outil, sur ce que c'est que l'évaluation externe conjointe, ce que c'est que le plan national d'action pour la sécurité sanitaire, tous ces documents cadres-là, pour qu'ils puissent piloter l'outil en ayant déjà toutes les informations. Parce que le premier constat qu'on avait eu à faire durant le pré-test de l'outil, c'est que tout le monde n'était pas au même niveau d'information concernant tous ces documents cadres-là, qui sont la base même des indicateurs de la Community Scorecard. Donc, il faudra vraiment au préalable briefer toutes ces parties prenantes là sur ces notions de base qu'elles mettent en œuvre au quotidien, mais qu'elles ne connaissent pas forcément nommément, afin vraiment de piloter l'outil de manière optimale, en ayant tout le monde au même niveau d'information. Alors, pour conclure ici, l'outil, nous avons eu l'opportunité vraiment de piloter l'outil de la Community Scorecard au Cameroun. Et cela a été fait selon une approche vraiment multisectorielle en associant les populations clés, la société civile, les différents ministères, et ce qui fait en sorte que les résultats qui sortent du pilotage de cet outil sont très peu contestables, et ce qui fait en sorte que l'outil en lui-même représente un outil puissant. Donc, cette expérience ici a mis en lumière plusieurs défis persistants, notamment dans l'intégration effective de l'engagement communautaire des droits humains et du genre dans la préparation et la réponse aux pandémies au Cameroun. Mais au-delà du diagnostic, cela représente également une opportunité stratégique ici qui meuble vraiment notre stratégie de plaidoyer. Donc, c'est une base vraiment solide pour intensifier notre plaidoyer en faveur de la participation communautaire dans tous ces processus-là, tous ces mécanismes-là de préparation et de réponse aux pandémies. Donc, on dira ici que le chemin est certes encore long, mais nous avons désormais une sorte de boussole plus fiable pour parcourir ce chemin. Donc, sur ce slide, je vous remercie.
All right. Thank you, Bernadette, for the presentation. I think what I really appreciate about your talk is how you walked us through the different steps on how to really implement the scorecard. So it's not just a tool that was used, it's not just a document, but something that is used by the communities as well as the government. And I think right now I also have that appreciation that the tool can be used for probably cross country comparisons, but at the same time it can also be used to track the performance of a specific country after several years. So a more longitudinal study might also be interesting to have, right? Okay. Thank you, Bernadette. Let's give her a round of applause, a virtual round of applause. And I also see that there are people already placing their comments in the chat box. So again, if you have questions or comments with regard to the presentation of Gemma or our two country pilot implementers, please feel free to put them in the chat so that we can read them. So now I'd like to invite again our speaker, Gemma, to join us in the virtual space, as well as Paul and Bernadette, so that we can have a question and answer portion. Okay,
Yeah, thank you.
so
I think I have questions on the platform already by Olive, which
yeah. Okay, so we can go first to Olive's question. Uh-huh.
okay.
Okay.
Can I
So
respond?
yeah, so let me just first read the question and then I'll turn it over to you, Paul. So the question of Olive is, at what point in the national PPR processes could be opportunities for including the scorecard findings or recommendations? Could you speak more to that? Go ahead, Paul.
Thank you very much, Oli, for that question. At the national platform, we have the National Action Plan for Health Security, of which getting access to these have to do with a lot of protocols and procedure. Already, we have the resolve to save life on the platforms already. So what we did was to strengthen it and advocate for more strengthening of communities into the surveillance activity. So that has already been taking place on the National Action Plan for Health Security. And again, on the RCCE, that is the Risk Communication and Community Engagement at the national committee level, there is absence of the nomads as well as other voices on the platform. So based on the users of this tool, as well as some of the advocacies we are able to do, currently, as I speak to you, the platform was highly released to all, not only the nomads, but all those in our national platform. So any disease, not really pandemic, epidemic disease, and knowledge sharing was actually shared on the platforms currently, and all and every individual have access to that channels as well. So, and again, to secure a permanent seat, what we are trying to do currently is to work together with the CSOs to see how we can increase the advocacy at the national level, where the CSOs as well as committee can have a permanent seat on those particular platforms. And this is currently what we are highly working on it. And by the way it's going, we'll be having a great impact on this and then great outcomes towards this. Thank you. I don't know if I answered your question very well. Thank you.
Thank you, Paul. How about Gemma or Bernadette? Do you have any ideas on how to further integrate the scorecard findings or recommendations? I also see Olive giving a thumbs up sign. Or if not, we can move to the next question. Actually, it's more of a comment from Kith Vanthi. Um, they say, how can this tool be used worldwide? Due to some countries, they may not well be informed about the tool. So they may need a broad consultation with relevant stakeholders or review the indicators to adapt and adopt to the country context. So maybe Gemma might be the right person to expound on this more. So how were the indicators developed? How were they selected? And any suggestions how to adapt it in the country's context?
Sure, I can't answer exactly because I worked with a colleague on this, and she was largely responsible for designing the indicator selection, you know, the sub-dimensions and all that, and so were the other team members. So perhaps those who worked on the indicator selection can comment, but what I can say is that they were aligned with other existing PPR assessments. So trying to align with indicator frameworks that already exist, and those links are there, so that we're using established metrics, and even some of the thresholds, like the 3 different levels, are also taken from existing assessment tools for PPR. So it creates a bit of a civil society shadow report in a way, using established measurements. That's one part of it. I also wanted to respond to some of the previous question, which was around how the findings can be used. I think as countries are gearing up for the next grant cycle of the Global Fund, for grant cycle 8, I'm sure that some of these results and the actions can feed into some of the health system strengthening priorities, health and community system strengthening priorities for grant cycle 8. So we can be thinking about that as well. I'm sure this would be a useful exercise as people are coming up with their priorities.
Yeah, that sounds exciting. Let me first go to Olive and then Bernadette. I think it might be a quick response. Go ahead, Olive.
Yes, thank you so much, RJ. And I just wanted to add on to what Dima has mentioned. in terms of the indicators, the selection was based on the IHR, the International Health Regulation Framework, that also provides clear PPR indicators. And also we utilized some other tools, which are the gender and human rights, also community engagement tools, to also identify, when it comes to inclusion of gender and human rights, what could be some of the things that we should be looking out for. And especially when also for community engagement, we also utilize tools that are already existing. So I just wanted to add on to what Gemma has mentioned. We know that there are many tools out there, but we also related to when a pandemic comes, based on the experiences, how could this look like? So we also got a lot of input from the team that piloted on the indicators as well. Each one of them was also working with a team of with a consultant. So that really helped to inform the indicators themselves. And I also do agree that in terms of the question that I had asked Paul about opportunities, within the process of the national PPR processes, first of all, there's a review, which is the joint external evaluation. During that process, they look at the indicators and they identify whether, they carry out a review and see whether the country has met any of those processes. So that's one opportunity place where communities can also bring the recommendations. Then secondly, as Paul mentioned, is during the the development of the National Action Plan for Health Security, the NAPS, which is also a very key process. But there are other processes as well when they're developing the One Health strategy, or as Gemma has mentioned, even taking these recommendations into other opportunities like Pandemic Fund, like the Global Fund. When there's any opportunity that exists, it's quite critical that communities utilize it. I just wanted to expand on that. Thank you so much for giving me that opportunity.
All right, thank you, Olive. So there's many different platforms where the findings can be brought, but I think what's good about this is that we have a baseline on where to base our advocacy on, right? So Bernadette, would you like to add to that?
Yes, if I can add something, Olive l'a si bien dit. Les indicateurs qui ont été utilisés là pour avoir longtemps travaillé sur le dit ici au Cameroun, on a constaté une adéquation avec la troisième édition. Donc la troisième édition du manuel dit qui coule de source du règlement sanitaire international, comme Olive l'a mentionné, inclut les indicateurs sur les droits humains, sur le community engagement qui était déjà dans les deux précédentes versions du manuel dit et sur le gender. Vous allez voir la particularité de ce troisième manuel. Pour ceux qui auront la curiosité d'aller le lire en comparant avec le deuxième manuel, c'est que le deuxième manuel était beaucoup plus focus sur le community engagement et le risk communication. Par contre, la troisième édition qui est sortie inclut les trois indicateurs. Également sur la question sur comment est-ce qu'on pourra utiliser les conclusions émanant de la Community Scorecard. Nous, ici au Cameroun, on a d'abord renforcé les conclusions émanant du pilotage de cette outil. On les a inclus dans notre Advocacy Agenda. Et les premiers résultats qu'on a eus, c'est que en présentant l'Advocacy Agenda lors des réunions de plaidoyer avec les décideurs ou même les réunions de coordination avec les membres de la société civile, c'est que cet outil-là, renforcé par les résultats de la Community Scorecard, parce que vous savez qu'on prend je vais dire quoi, on prend des résolutions à base d'évidence et ça constitue ici une grosse évidence pour le plaidoyer. Donc, durant les réunions de plaidoyer, ces différentes évidences-là étaient utilisées justement pour renforcer l'implication des décideurs, pour favoriser également l'implication des communautés dans ces différentes plateformes PPR là, qui n'étaient pas encore constituées des communautés. Donc, à date, on a plusieurs comités PPR qui ont déjà commencé les mécanismes pour pouvoir inclure les communautés dans leurs mécanismes de prise de décision et ce qui va avec. On a également été inclus dans, par exemple, l'élaboration du plan national choléra grâce à ce plaidoyer qui a été mis en œuvre là, à base de ces évidences-là, du plan national sur la fièvre jaune. Et même lors de la révision du rapport de préévaluation du DII au niveau national, on a été inclus, les communautés ont été fortement inclus lors de la révision de cet outil. Et même durant l'élaboration du Pandemic Fund, les communautés étaient fortement impliquées grâce au plaidoyer qu'on a eu à mener à base des évidences générées par cet outil-là. Donc, cet outil, du moins les résultats que vous aurez obtenus à base de cet outil représentent des éléments de plaidoyer forts auprès des décideurs, là, pour leur montrer qu'en effet, il y a une faible implication des communautés et par rapport à ce que nous avons vécu lors de la pandémie à COVID-19 ici, nous devons plus être autant fragilisés, d'où la nécessité de l'implication des communautés à tous les niveaux de prise de décision.
Can I add something?
All right, glad to hear that, Bernadette, especially how the tool was also used to strengthen the different communities that advocated for different things, right? And I think one of the things that was mentioned in the chat is how the tool can also produce a community shadow scorecard for a JEE and other plans, right? But I'm also thinking that, especially in some countries where the relationship between the civil society and the government is not that tight, or is not that close. Are there because in other areas, when the community usually presents a tool and then they provide the findings to the government, it gets discredited by the government. So have you encountered that risk, or how do we actually also manage those, just in case? Because I think based on the example of Nigeria and Cameroon, the government collaboration was quite strong, but it might not be always the case for all countries. So any guidance on that, Gemma? Or maybe from Paul or Bernadette or Olive. Sorry to put you on the spot.
Yeah, it's fine. Yeah, thank you very much, RJ. And again, maybe to just add on it again, like starting from the point of Olive, one of the key things that is very essential to us in Nigeria is that we have a different platforms where
Paul, we
diseases have
can't
been.
hear you if you're speaking. Oh, I'm in the wrong channel. Sorry.
Go ahead, Paul. I think this time he froze. Paul? Or is it my internet?
No, it's frozen for me. Sorry, I was sitting in the English channel. That's why I couldn't hear
Yeah.
you.
All right, so let's wait a few more seconds for Paul to come in. Maybe Bernadette, do you want to add, or you want to provide also insights while waiting for Paul?
RJ, could you ask the question again once more?
Yeah, of course, we saw from the sharing of Bernadette and Paul that civil society relationship with the government is quite strong, and that actually facilitated the uptake of the findings of the community PPR scorecard, and they used it. They were able to maximize it. But in some countries, the relationship of the government and civil society is not that mature yet. So, of course, that risks the findings from the civil society being discredited or delegitimized by the government. So, any guidance on how to manage those kinds of situations? Because that might be a risk for some.
Okay, thank you so much for that question. I think it's quite critical. Maybe I know Bernadette and Paul could talk around their own experience. However, how because of the setup of how the project was, which we hope could also be, we'll find that there are already existing PPR platforms or coalitions in most of the countries. That's one thing that we found out, even in Cameroon. I think they were already participating and engaging in PPR processes. So this tool, one, would act like a way of them being able to get information into these processes. However, these platforms are already doing a lot of advocacy work. So one of the key areas where there is not already space open is to encourage dialogue, encourage partnerships, encourage conversations with the organizations or with the government sectors that work on any PPR related process. And in some countries, like Indonesia, I think they work on disaster and emergencies. That's also an opportunity where they could also utilize such type of a tool. And it's about building partnerships with the government sector, but also utilizing where they have a PPR platform. That could also be another opportunity where you could conduct this utilize that platform to conduct the scorecard and get the findings, and then utilize that as for conversations and for advocacy as well. Thank you.
Yeah.
Bernadette and Paul would have additional and more practical experience than I would.
Yeah, thank you, Olive.
Okay. Benedict, are you going first, or I should go?
Oh,
Bernadette can go first, and then Paul.
ok. En fait, au niveau du Cameroun, s'il faut vraiment donner des recommandations pratiques, même dans tous les autres pays, c'est de vraiment donner de la visibilité dans tout ce que vous faites. Parce que les activités ou bien les interventions que vous mettez en œuvre, quelquefois, ne sont pas connues du gouvernement. Et c'est ça qui fait en sorte qu'on conteste la plupart du temps les résultats et tout ce qui va avec. Dans toute intervention que vous mettez en œuvre, les activités que vous mettez en œuvre, essayez de convier un ou deux membres d'institutions centrales dans votre pays qui sont au cœur de la mise en œuvre de cette thématique-là. Parce que la société civile, les communautés n'agissent pas en marge du gouvernement. On vient en appui aux interventions nationales. Donc vraiment, à chaque fois, je vais le dire comment. Lorsque vous organisez des interventions, toujours mettre de la visibilité dessus, toujours inclure un membre du gouvernement dans cette mise en œuvre. Aussi, même si à ce niveau, peut-être lors de la planification, vous ne l'avez pas fait, vous pouvez rattraper le tir en les envoyant vos rapports, en les envoyant des petits policy briefs, donc des documents vraiment informatifs pour qu'ils puissent avoir l'information clé en ce qui concerne la thématique en question et je vais dire quoi? Ne banalise pas ou alors réfute à chaque fois vos résultats. Et justement, lors du pilotage de la carte score, je l'ai dit, on a prétesté l'outil avec les membres de la société civile pour avoir les données brutes. Et maintenant, c'était un peu comme une session de validation, de prétest proprement parlé. On a invité les membres du gouvernement pour qu'ils voient de leurs propres yeux les résultats à l'état brut. Il n'y avait pas de maquillage, il n'y avait rien pour arranger les données. C'était les résultats bruts. Il y avait des indicateurs, on était à 1. S'il y avait même s'il y avait l'indicateur 0, on allait même être à 0 parce que de manière factuelle, ça n'existe pas. C'est de très faible niveau. Donc, il faut quelquefois les associer à ces mécanismes-là pour qu'ils puissent toucher du doigt la réalité et pour qu'ils puissent s'approprier ces résultats-là. Maintenant, de deux, même si vous êtes déjà connu au niveau du pays et que, je vais dire quoi, vous avez une certaine visibilité, à chaque fois, il faut renouer la collaboration avec eux. En fait, ça doit être une collaboration continuelle avec les membres du gouvernement. À chaque fois, les associer à ces mécanismes-là pour qu'ils puissent quelquefois même appuyer même ces interventions.
Yeah, thank you, Bernadette. Go ahead, Paul.
All right. Thank you very much, RJ. Like what Olive mentioned, one of the key area is the JEE in terms of the evaluation. The second, we also have the SPA, which is annually carried out. And again, the NAPS, which is also key. In Nigeria, most states have what we call the stakeholders platform meeting, where partners as well as state government come to meet together to review the impact of what they are doing. And this is a partners to as well as the government relationship. And again, at the national level, we also have a technical working group, which is called the IDSR, standing for Integrated Disease Surveillance Response Technical Working Group. Again, we have several platforms, but One of the key things that will make a sustainability is the inclusion of all CSOs as well as community into this platform. Not only partners, not only those who contribute in terms of funding, but also those who this activity would go to. So this is currently what we are working on. And for sustainability at the national level, there is need for a budget line of which together we are also making a great advocacy to the House of Assembly for the budget line for CSOs to have a budget line in terms of monitoring of NAB's activities as well. So if you are able to have the CSOs as well as the community on those key platforms which are key essential, then definitely this scorecard will help a lot as an evidence base to show those platforms that this is what we have gotten from the community and this is what we want to be included. That will actually pave a long way and a stress in terms of a lot of gaps. So this is highly what we are working on in Nigeria. Thank you.
All right. Thank you, Paul and Bernadette. Really insightful comments there. Really practical as well. So what I'm hearing from you is that we have to really cultivate trust with our government counterparts. We have to cultivate that relationship by informing them, engaging them in the different steps that we're taking as part of civil society, and also lobbying for institutionalization of these kinds of engagements by, like what Paul mentioned earlier, advocacy for having line item budgets, no, for civil society participation. So really great answers from both of you. Anyone else who has a question? So maybe someone from the audience who wants to ask their question live. Anyone? Okay, so if there are no questions, I'd like to also ask this question because you already piloted the tool, and you've had a lot of experiences and feedback coming from different stakeholders. So I'm also curious to know if there are new indicators that you're looking at that you want to add to the tool or any modifications to the tool based on the initial run. Anyone can answer. Or any changes on how the tool is administered, probably?
Yeah, thank you very much, RJ. I think the tool have actually identified all key considerations, both in terms of gender and human rights, which is holistic in nature, as well as community participation in different processes, response, as well as preparedness. One of the key things that we added as a recommendation before now was to have this as a live dashboard, which is key. And then using it also needs some level of understanding. So maybe though it is actually in an Excel form, but having it on another dashboard that can easily be accessed for more transparency so that anybody can click on and see this is what we are able to assess, this is our outcomes, and that is, so that even if you are not there, it's something can actually, so something of that nature is very key for us in Nigeria, especially knowing who were able to assess, what were their response, and so on. And also a highlight in all the questions so that you'll be able to identify, the highlight will tell you what these questions is all about in a simpler way. And again, we know that in Nigeria, if we want to have a holistic information, then definitely we can also have an interpreted version of it to our own local language so that everybody will equally and equitably participate. Thank you.
All right. Thank you, Paul, for that insight. Like having a visual dashboard really helps making sure that everyone is on their toes when it comes to making sure that civil society is actively engaged in the process. Any other additional insights before we wrap this session? Okay, going once, going twice. Okay, none. So if not, let's give our speaker, Gemma Oberth, a warm round of virtual applause, as well as Bernadette and Paul for sharing their country's experiences in working on the PPR committee scorecard. So with that, I'd like to send the certificate of appreciation to Gemma for their contribution in lessons 11, as well as Paul and Bernadette. So we'll be sending you a copy of this certificate later on. Okay, so I'd like to also take this opportunity to have a photo with everyone. So if you're comfortable, kindly turn on your cameras, and then we will take a group photo with everyone. Right, nice to see everyone. Okay, so we'll wait a few more seconds for people to turn on their cameras.
Everyone ready? Okay, we have 4 panels today, so I'm gonna start taking photos from the first panel. All right, give us your best smile. 1, 2, 3. Oh, only 2 panels. Okay, and then another one. 1, 2, 3. Thank you.
All right, thank you, Jeff. And we also invite everyone to answer this evaluation form. So you can scan this QR code or also go to this link bit.ly for NULCB5 to access the evaluation form. So we need your email addresses so that we can send you the files later on. And also invite you to our last lessons webinar. So this is actually the second to the last lessons. So we hope that everyone can join us in our last webinar that focuses on national public health institutions. So it's going to be very exciting to also talk to government counterparts, especially coming from a civil society perspective. And we also invite everyone to join our WhatsApp group. So if you want to be updated, you can share your takeaways from the discussion, share relevant materials, and also ask questions. So even our speakers, we invite them to join this WhatsApp group so that you can interact more. I'm sure there are some questions related to the scorecard in the next few days, especially as you go through the full document. All right, so I think that's the last part of our session. Thank you everyone for joining lessons 11 and looking forward to seeing everyone in our last uh, lessons webinar on October 14. Right. Thank you everyone. Have a good morning, afternoon, or day. Thank you also to our translators who joined us for today. Some, Jeff, thank you, and also our colleagues from the Global Fund who also joined us.
Thank you, RJ.
Right, so we'll keep this slide up for a few more seconds before we end the call.
Thank you, everyone. Have a good day.
Thank you, Bernadette. Thanks, Jeff.
Thank you.
Thanks, Wendy.